Effectively communicating the care plan to the patient requires an appreciation of where the patient is at, what support systems they have, and what your experience with them has been in the past with directions, medication adherence, and their own experience in what works best for them. It's important to understand what type of learner they are and what kind of things are easy, make it easier for them to adhere to the regimen or the plan, as well as the things that could be barriers. For example, if they have reading problems or hearing problems, you'll need to adjust the explanation and the format in which the plan is conveyed differently. In it's important to focus on really patient-centered interactions. What are you trying to get out of from the patient? What are they trying to get out of their treatment? How are you really developing yourself as a team so that you're their trusted physician and healthcare provider, and they're an activated patient? What activates them in terms of their values, their goals, and the support that they have? What we really want to do is expand on their role in decision making in terms of behavior change and self-management. It's important to respect their values and preferences and let your plan reflect that. An example of a graduated care plan might be for diabetes. Most of the guidelines recommend 3 things for diabetics: statins, metformin, or another control agent, and ACE inhibitors. That's a big medication burden for somebody who may still be dealing with the diagnosis of diabetes. And it's important to sit down with them, or have your staff sit down with them and help understand how they're dealing with the diagnosis to start with. And then as you move into it, find out how they're looking at their medication and how they're looking at the treatment plan. Traditionally we started people on medications for diabetes when they, quote, failed, unquote, diet and exercise. And so the message we often give to patients, without meaning to, is that you're on medicine because you weren't doing a good job. Whereas the other approach in terms of getting an activated patient and creating a care plan that's a shared plan is to say, here's why we're doing each one of those. Would you feel more comfortable starting a medication, those medicines one at a time and gradually moving into them? Which would you choose? What's most important to the patient? For perhaps their blood pressure is the real problem for which you're treating. That may be the priority. And having a patient get empowerment and success in each medication or treatment as you go through the plan of care, so that they're sensing accomplishment and they're sensing that you're in the boat with them and understand where they're coming from.